If you're over 60 and still masturbating the same way you did in your 20s, you could be slowly destroying your penis and not even realize it. I've seen men cripple their erections, erase sensation, and kill their confidence forever with one hidden habit. Stop the damage before it's too late. Urologists rarely warn about this deadly senior mistake, yet I see it cripple men daily. What your doctor won't say, but you must know. The journey of aging brings countless changes, both visible and hidden, and for men over 60, the relationship with one's own body, particularly sexual health, often becomes a silent source of confusion, frustration, and sometimes profound loss. If you find yourself in this stage of life and are still engaging in masturbation the same way you did decades ago, with the same intensity, the same techniques, the same mindset, you might be unintentionally, slowly, yet significantly harming the very organs central to your sense of masculinity and pleasure. The damage isn't always dramatic. It creeps in subtly, like the gradual fading of a photograph left in the sun. I've witnessed too many men walk into my clinic, initially proud of their consistency, their enduring drive, only to have their world shatter when they learn that their cherished routine is the very root cause of weakened erections, diminished sensation, a pervasive numbness where pleasure once resided, and a confidence that seems to have evaporated overnight. What they dismissed as harmless, even healthy self-expression was in fact a slow, insidious assault on their penile health, often leading to changes that are difficult, sometimes impossible to fully reverse. The shock, the grief, the tears that follow such a revelation are deeply etched in my memory, driving me to reach out before it happens to you. I am Dr. John Garret. For over 30 years, my life's work has revolved entirely around men's health, specifically urology and sexual medicine. My hands have performed thousands of delicate surgeries on the penis, from correcting structural issues to addressing the devastating consequences of neglected trauma. My consulting room has been a sanctuary for countless older men burdened by shame, confusion, and the fear that a vital part of their identity is slipping away. I've listened to their whispered anxieties, examined their concerns with meticulous care, and crucially, I've guided many back from the brink, helping them reclaim not just function, but a profound sense of dignity, self-worth, and the inner peace that comes with understanding and control over their own body. I'm speaking to you with such urgency today because the pattern I see is heartbreakingly preventable. Men are suffering needlessly, sacrificing their sexual vitality on the altar of habit, simply because no one explained how profoundly the rules change after 60. You don't have to become another statistic in my files, another case of irreversible damage, not when the power to protect yourself, to heal, and to thrive is still very much within your grasp, if you act with knowledge and intention. You've likely absorbed the cultural message throughout your life. Masturbation is natural, it's safe, it's even beneficial for stress relief and prostate health. And broadly speaking, this holds truth for younger bodies. But crossing the threshold of 60 is not merely adding another candle to the cake. It heralds a fundamental biological shift. The tissues composing your penis, the intricate network of blood vessels that engorge it, the delicate skin that sheathes it, the sensitive nerves that translate touch into exquisite pleasure, and the prostate gland intimately involved in ejaculation and sexual function, all undergo significant changes. They lose resilience, become more fragile, heal slower, and respond differently to stimuli. Blood flow, the very engine of an erection, naturally diminishes. Collagen and elastin, the proteins providing skin elasticity and structural support, decrease. Nerve endings can become less responsive. The prostate often enlarges, becoming more susceptible to inflammation. What felt exhilarating and harmless in your 20s or 30s, a firm grip, a vigorous pace, the friction of dry skin, can now, in this altered landscape, become a source of microtrauma, inflammation, scarring, and cumulative damage.
The activity itself isn't the enemy. It's the how that becomes critically dangerous when applied to an aging physiology. It's like using the same heavy tools on antique furniture as you would on a new oak desk. The older, more delicate structure simply cannot withstand the same force without sustaining harm. Yet, amidst this necessary caution, there is powerful, genuinely hopeful news. The damage caused by inappropriate techniques is often not a life sentence. Once you understand the specific pitfalls, the 5 most common and dangerous masturbation mistakes men over 60 routinely make, you possess the key to not only halt the deterioration, but actively reverse much of it. You can begin a process of restoration, improving crucial blood circulation to nourish penile tissues, gradually coaxing back lost sensitivity, reducing inflammation, and ultimately unlocking a far more connected, satisfying, and fulfilling relationship with your own body and its capacity for pleasure. This isn't about chasing the intensity of youth, but about discovering a deeper, more sustainable intimacy with yourself. The most startling revelation for many men, however, is realizing how ubiquitous the first mistake is. It's so ingrained, so normalized, that it flies completely under the radar, silently wreaking havoc. Almost every single senior patient I've treated over the years, regardless of background or health status, has been guilty of mistake number 1, often for decades.
Before we delve into the critical details of these mistakes and the path to correction, I urge you to consider the profound importance of this information for your future quality of life. If you're serious about preserving your sexual function, maintaining your confidence, and safeguarding your intimate relationships as you navigate your later years, make a commitment to staying informed. If you're engaging with this content, please subscribe and turn on notifications. This ensures you never miss vital updates, deeper dives into specific issues, or new strategies that could literally save your sexual health, your sense of self, and your future well-being. Your engagement also signals what matters most to you. If this message resonates deeply, if you recognize yourself or feel a spark of concern or hope, please type the number 1 in the comments below. If, however, this feels irrelevant or unhelpful to you right now, type 0. Your honest feedback is invaluable. It guides me in creating content that truly addresses your needs, your fears, and your aspirations for a healthy, vibrant life after 60. Knowing what resonates allows me to tailor my advice to be more meaningful, more impactful, and directly relevant to the men who need it most. All right. Now that we've established the critical importance of adapting your self-care practices to your evolving biology, let's confront the first and arguably most pervasive and physically damaging mistake plaguing older men during masturbation. It's a scenario I encounter with alarming frequency in my clinic, almost weekly. The men exhibiting its consequences are usually completely oblivious, utterly unaware that their habitual technique is the primary culprit behind their declining sexual experience. This habit insidiously erodes penile sensitivity, restricts the vital blood flow necessary for firm erections, and over the relentless passage of time can utterly sabotage your ability to experience genuine, connected intimacy, whether alone or with a partner. We need to talk about the devastating impact of excessive force, commonly known as the death grip. Mistake 1, the death grip dilemma, when habitual force becomes destructive. I wish I could convey the sheer volume of older men who sit across from me in my office, their faces etched with frustration, deep confusion, and often palpable embarrassment. Their stories share a common, painful refrain. "Doctor, I just don't feel it like I used to." They describe erections that lack the former rigidity and staying power, orgasms that feel muted, distant, almost hollow, a mere physiological release devoid of the rich, satisfying pleasure they once knew. They feel a profound sense of loss, a gaping hole where sexual joy used to reside, yet they have no clue what caused it. Every single time my diagnostic path leads me to ask a crucial, revealing question. Can you describe exactly how you stimulate yourself? Tell me about your technique, your grip, your pace, And almost without fail, the answer unveils one of the most destructive habits I observe in my practice. The death grip might sound overly dramatic, even sensationalized, but I assure you it's frighteningly accurate in describing the damage inflicted. The death grip refers to the habitual application of excessive pressure during masturbation. It's characterized by squeezing the penis far too hard, pulling the skin with undue force, employing an overly vigorous speed, and an aggressive, almost punishing rhythm. It's a technique often developed unconsciously over many years, frequently rooted in the pursuit of a quick climax during adolescence or young adulthood, where the penis was more resilient. It becomes muscle memory, an ingrained pattern executed without conscious thought. However, this is where the brutal reality of aging intervenes. After the age of 60, the tissues of your penis undergo significant changes that render them utterly incapable of tolerating that level of mechanical stress. The skin covering the shaft becomes noticeably thinner and more delicate, losing much of its protective fatty layer and collagen support. The intricate network of blood vessels within the corpora cavernosa, the sponge-like structures that fill with blood to create an erection, become more fragile, their walls less elastic, more prone to damage from compression. Most critically, the nerves, especially the incredibly fine, specialized nerve endings densely packed in the glands, head, and along the shaft, responsible for transmitting the exquisite sensations of touch, temperature, and vibration, become significantly more vulnerable to injury from sustained pressure.
Imagine the delicate wiring of a sophisticated device. Applying crushing force damages the insulation and breaks the connections. This is what happens neurologically. When you employ the death grip, you aren't just seeking stimulation, you are actively traumatizing the organ. With each forceful, constricting stroke, you risk several types of damage. You physically compress and potentially damage the blood vessels, impairing circulation and oxygen delivery to the tissues, which is essential for both erection quality and tissue health. You create microscopic tears in the skin and underlying structures, leading to inflammation and, over time, the formation of fibrous scar tissue. And crucially, you inflict blunt trauma on the delicate nerve endings and pathways. This nerve damage doesn't just mute pleasure, it can disrupt the complex neurological feedback loops essential for achieving and maintaining an erection. The consequences manifest in various, often devastating ways. Some men arrive at my clinic reporting a near-total loss of penile sensitivity, a profound numbness where even direct, firm touch registers little sensation. Others exhibit a noticeable reduction in penile size or girth, not due to aging alone, but because of internal scarring, fibrosis, within the erectile tissue caused by repeated microtrauma, which literally stiffens and reduces the expandable capacity of the corpora cavernosa. A particularly severe consequence can be the development of Peyronie's disease, a condition characterized by a painful curvature of the penis during erection, caused by plaque formation within the tunica albuginea, the fibrous sheath surrounding the erectile chambers, a condition strongly linked to penile trauma, including the kind inflicted by chronic, forceful masturbation. The most tragic aspect is that the vast majority of these men had absolutely no awareness they were inflicting this damage upon themselves. They were simply doing what they'd always done, never connecting the dots between their technique and their declining function and sensation. I share this stark reality with you now, not to induce paralyzing fear, but to serve as a vital wake-up call. It's a plea for heightened bodily awareness. If you recognize that you're still using the same grip strength, the same intensity of motion, the same overall technique that you employed in your 20s or 30s, it is imperative that you stop immediately. Your body is fundamentally different now. What once felt normal, even necessary for arousal, can now be actively destructive. You owe it to yourself, to your future well-being, confidence, and capacity for pleasure, to adopt a radically gentler approach. Treat your body with the reverence it deserves at this stage of life, because it absolutely matters. Every single stroke now carries weight. Invest in high-quality lubrication to minimize harmful friction significantly. Consciously soften your grip. Imagine holding a delicate bird, applying only enough pressure to feel, not to crush. Slow your rhythm down considerably. Allow sensation to build gradually rather than forcing it through intensity.
Most importantly, be profoundly present. Tune into the actual sensations your body is providing, not the memory of past intensity. Notice the subtleties of touch, temperature, pressure. This mindful, gentle approach is the pathway to preserving your remaining sensitivity, encouraging the restoration of healthy blood flow, and genuinely reclaiming sustainable pleasure. It's not achieved through brute force, but through profound respect and attentive care for the vessel of your sexuality. While the death grip represents one of the most direct physical assaults on penile health, the next mistake we need to address penetrates even deeper, targeting an internal organ crucial to both sexual and urinary function. Ignoring this mistake doesn't just affect the surface, it impacts your prostate, and the resulting discomfort can be persistent and deeply unsettling, often catching men completely off guard. It's time to confront the risks associated with overlooking your body's internal signals. Mistake 2. Masturbating without lubrication. The silent abrasion of aging skin. The memory of one particular patient vividly illustrates the consequences of this common oversight. He was 72, enjoying his retirement, and commendably maintaining an active sexual life through masturbation, something I actively encourage for overall health and well-being in older age. However, he arrived at my office visibly distressed, reporting persistent irritation, a raw discomfort along his shaft, and a gnawing anxiety that something was seriously, perhaps irreparably, wrong with his penis. After a thorough examination ruled out infections or skin conditions, a few careful questions revealed the core issue: a lifelong habit of masturbating completely dry, no lubricant of any kind ever, just the repeated friction of dry skin sliding over dry skin, session after session, year after relentless year. His body, having endured this for decades, had finally reached its limit, signaling its distress through inflammation and pain.
Masturbating without lubrication might seem like a trivial matter, especially if it's a technique ingrained since adolescence. You might think it never caused problems before, or it feels more natural. I need to be unequivocally clear. After 60, this practice transforms into one of the easiest, most insidious ways to injure your penis without any immediate dramatic signs. The skin of your penis undergoes significant changes as you age. It becomes markedly thinner, losing collagen and elastin, making it far more delicate and fragile. Its natural moisture barrier weakens, and its ability to heal even minor abrasions slows down considerably. Each stroke without lubrication creates friction, skin dragging against skin. While a single session might only cause mild redness, the cumulative effect over months and years is devastating. This constant friction leads to chronic irritation, microscopic abrasions, microabrasions, and critically, the formation of scar tissue. The signs often emerge gradually. Men might notice that the skin on their shaft feels rougher, less supple, perhaps slightly thickened or calloused in areas. Sensitivity diminishes. The once pleasurable touch now feels muted. Some report a sensation of tightness, a lack of elasticity that wasn't there before. This isn't simply an inevitable consequence of aging. It's active damage caused by repeated mechanical insult. The friction physically wears down the skin's protective outer layers, accelerates the breakdown of collagen and elastin fibers, reducing elasticity, and triggers low-grade inflammation within the dermal layers. Once inflamed, penile tissue becomes more vulnerable to further injury, more prone to developing lichenification, thickened leathery skin, and in severe cases can lead to the formation of hardened plaques or bands of scar tissue beneath the surface, fibrosis. This fibrosis isn't merely a cosmetic issue. It can permanently alter the texture, flexibility, and even the curvature of the penis, potentially impacting both appearance and function. Furthermore, inflamed and damaged skin is more susceptible to secondary infections. The critical point here transcends mere comfort. Using lubrication is fundamentally about preserving the structural integrity and functional capacity of your penile skin. It safeguards your ability to experience physical pleasure and actively helps you avoid painful, potentially chronic complications down the line.
The truth is, there is simply no valid excuse to forego lubrication after 60. The market offers a wide array of options: water-based, silicone-based, hybrid, or even specialized moisturizing formulations designed to suit different preferences and needs. The right lubricant creates a protective, slippery barrier that drastically reduces friction, minimizing shear forces on the delicate skin. It acts like a cushion, preventing the micro tears caused by dry contact. Moreover, adequate lubrication allows the skin of the shaft to glide smoothly over the underlying structures, reducing constriction and facilitating healthier blood flow, a factor that becomes exponentially more critical as natural circulation tends to diminish with age. If you've never incorporated lubricant into your routine, or if you use it sporadically, I urge you to make it an absolute, non-negotiable part of every session. Transform it into a consistent habit, as essential as washing your hands. This one simple, readily available intervention offers profound protection for your penile skin, helping to maintain its health, resilience, and sensitivity for years to come. It's a tangible act of respect for your body's vulnerability in this phase of life. Remember, unlike the resilient skin of youth, the damage inflicted by chronic friction on aging skin is often cumulative and not always fully reversible. Prevention is infinitely preferable to attempting repair later. While skin irritation and the gradual loss of surface sensitivity are significant concerns, the implications of the next mistake extend far beyond the external, reaching into the core of your reproductive and urinary systems. Ignoring this aspect can lead to chronic internal discomfort, dysfunction, and significantly impact your quality of life. We must discuss the critical importance of heeding the messages your prostate sends, particularly around and following climax.
Mistake 3. Ignoring prostate feedback. The hidden cost of overlooking internal signals. Among the most frequently underestimated dangers I observe in older men is one that remains completely invisible to the naked eye. It unfolds deep within the pelvis, specifically centered on the prostate gland, a small walnut-sized organ with an outsized role in male sexual and urinary health. Tragically, by the time many men acknowledge that something is amiss, they are often already resigned to living with persistent discomfort or dysfunction that could have been mitigated or entirely avoided with earlier awareness and behavioral adjustments. The crucial error lies in dismissing or rationalizing away the subtle signals your prostate sends, especially during and immediately after masturbation and ejaculation. Overlooking these signals is a mistake with potentially far-reaching consequences, quietly eroding sexual function, causing ongoing discomfort, and significantly diminishing overall quality of life. I regularly consult with men in their late 60s, 70s, and beyond who report troubling sensations they often attribute vaguely to getting older. They describe a persistent, dull ache deep in the perineum, the area between the scrotum and anus, sometimes extending into the lower abdomen or groin. Others report a distinct feeling of pressure or heaviness behind the scrotum, particularly noticeable after ejaculation. Some experience a burning sensation during urination following climax, or a sense that their bladder hasn't fully emptied. Others mention discomfort or even mild pain during ejaculation itself. It's vital to understand that these are not merely random, insignificant aches to be stoically endured as part of the aging process. They are specific, meaningful signs often pointing towards an irritated, congested, overworked, or inflamed prostate gland. And all too frequently, this state of irritation is directly linked to how they engage in masturbation, specifically the frequency, the intensity, forcefulness of ejaculation, and crucially, the lack of sufficient recovery time between sessions. The body signals a need for rest, but the habit persists, overriding the warning. The prostate, though small, is a linchpin in male sexual physiology. It produces a significant portion of the fluid that makes up semen, providing nourishment and motility for sperm. Its health is intimately intertwined with sexual function.
It surrounds the urethra, the tube carrying urine and semen, and is densely interwoven with nerves and blood vessels that are integral to achieving and maintaining erections. As men age, the prostate naturally undergoes changes. Benign prostatic hyperplasia, non-cancerous enlargement, is extremely common, often beginning in the 40s or 50s and progressing. This enlargement alone can make the gland more sensitive and prone to congestion and swelling. However, the habit of frequent ejaculation, particularly when combined with forceful techniques like the death grip or rushed sessions without adequate arousal buildup, can exacerbate this vulnerability. Many older men fail to grasp a crucial physiological fact. Repeated ejaculation without sufficient intervals for the prostate to recover and drain properly can lead to congestion. Seminal fluid and prostatic secretions can build up within the gland's ducts and acini. Over time, this congestion creates a perfect environment for inflammation to take hold, a condition known as prostatitis. Prostatitis, whether acute or chronic, is far more than a minor inconvenience. It causes persistent discomfort or pain in the pelvic region, perineum, genitals, or lower back. It can make ejaculation painful, significantly diminishing the pleasure of climax. It frequently irritates the urethra, leading to burning during urination, dysuria, increased urinary frequency, especially at night, nocturia, urgency, or a sense that their bladder hasn't fully emptied. Perhaps most insidiously, the inflammation and nerve irritation associated with prostatitis can directly interfere with erectile function, leading to weaker erections, difficulty sustaining them, or reduced rigidity. Importantly, chronic prostatitis is notoriously difficult to treat effectively with medication alone. It often requires a multifaceted approach, including significant lifestyle and behavioral modifications, precisely the kind we're discussing here.
This is why I emphasize so strongly to my older patients. Masturbation in this stage of life should never be approached as a race to climax. It must be reframed as an ongoing dialogue with your body. Cultivate deep awareness. Pay meticulous attention to how your body feels during the act and, critically, in the hours and even days afterwards. Are you experiencing any unusual sensations, any discomfort, pressure, aching, or burning? Do you feel drained or unusually fatigued? These are not signs to push through or ignore. They are direct communications from your prostate and surrounding tissues, signaling strain, overload, or inflammation. Pain, significant pressure, or persistent discomfort following ejaculation is not an inevitable tax paid to Father Time. It is a clear, urgent warning sign that demands attention and a change in behavior. Listen to it. Slow down. Increase the intervals between sessions. Allow your body, particularly your prostate, ample time to rest, recover, and reset. This attentive approach is fundamental to preventing chronic problems and preserving long-term sexual and urinary health. Up to this point, our focus has been primarily on physical habits, the pressure of your grip, the necessity of lubrication, the imperative of listening to internal feedback like prostate signals. However, the landscape of potential harm extends beyond the purely mechanical. What if the most significant danger wasn't solely physical, but involved the very organ controlling arousal, perception, and satisfaction? What if the visual content you consume during self-stimulation is silently, profoundly rewiring your brain, altering your arousal patterns, and ultimately eroding your capacity for genuine, connected intimacy with a real partner? We need to explore the profound neurological consequences of habitual, high-stimulation pornography use. Mistake 4. Habitual consumption of high-stimulation pornography, rewiring the brain's reward system. This mistake strikes at a deeper level because its impact is neurological and psychological, not merely physical. Over my decades of practice, I've encountered countless older men sitting in my consultation room, expressing profound bewilderment. "Doctor, it makes no sense. When I'm by myself, everything seems to work fine. I can get aroused, achieve an erection, reach orgasm. But the moment I'm with my actual partner in a real intimate situation, nothing happens. I feel disconnected, anxious, or just numb. While physical factors can contribute, the root cause in a significant number of these cases isn't vascular or hormonal. It's rooted in the brain. Specifically, it's frequently linked to long-term habitual consumption of high-stimulation pornography. I want to be absolutely clear. This discussion is not about moralizing, instilling shame, or dictating what you should or shouldn't watch. My role is that of a physician, concerned solely with your neurological and sexual health. I am here to explain, based on neuroscience and clinical observation, what happens to the male brain, particularly the aging male brain, when it is consistently exposed to intense, artificial sexual stimuli over extended periods. The human brain possesses an extraordinary capacity for neuroplasticity, its ability to adapt, rewire, and form new neural pathways based on experience and repeated stimuli. When you consistently feed your brain a relentless stream of high-intensity sexual imagery characterized by novelty, rapid escalation, exaggerated scenarios, supernormal stimuli, unrealistic body types, extreme acts, and constant variety, it fundamentally alters the brain's arousal template and reward circuitry. The brain begins to associate intense sexual arousal and reward primarily or even exclusively with the specific characteristics of the pornography consumed: the visual intensity, the rapid pace, the novelty, the specific acts depicted. This conditioning means your brain can start responding more powerfully to the pixels on a screen than to the complex, nuanced, and often slower-building stimuli of real human touch, authentic emotional connection, the scent of a partner, or the subtle cues of mutual desire. It's not that your intrinsic desire or capacity for intimacy has vanished. It's that your brain's reward system has been effectively hijacked by the artificial superstimulation. The neural pathways associated with arousal become wired to expect and require that specific high-octane input to trigger a significant response.
The consequences of this neurological shift are profound and multifaceted. This conditioning directly impacts physiological responses. Blood flow to the genitals may be harder to achieve in response to real-world stimuli, leading to weaker or less reliable erections, a condition sometimes termed porn-induced erectile dysfunction. The release and regulation of key neurochemicals like dopamine, associated with reward, motivation, and pleasure-seeking, and oxytocin, the bonding hormone, crucial for intimacy, trust, and emotional connection, become dysregulated. Real-life intimacy, which operates on a different, often more complex and gradual neurochemical pathway, may fail to trigger sufficient dopamine release, feeling comparatively dull or unrewarding. Oxytocin release during real connection might be blunted. I've counseled men who once possessed strong, naturally responsive sex drives, but over years of heavy porn use found that they could only achieve reliable arousal and orgasm with the aid of specific, increasingly extreme digital stimulation. The emotional toll is often heartbreaking. Feelings of isolation, inadequacy, frustration, and a deep sense of disconnection from their partners. The hopeful aspect is that with dedicated effort, time, and the right behavioral strategies, this neurological conditioning can often be reversed, but only if the individual recognizes the issue and commits to change early on. The longer the pattern persists, the more entrenched the neural pathways become, and the harder the rewiring process. Therefore, if you regularly consume pornography and find that real-life sexual intimacy with a partner feels consistently underwhelming, distant, emotionally flat, anxiety-provoking, or simply fails to arouse you effectively, heed this as a crucial signal. It's your brain communicating that it needs a reset, a recalibration. This doesn't necessarily mean quitting pornography entirely forever, though a period of abstinence is often the most effective starting point, but it necessitates conscious reduction and mindful change. Take deliberate breaks from porn. Significantly reduce your screen time dedicated to sexual content. Crucially, begin practicing masturbation without any visual or digital stimulation.
Relearn the art of connecting purely with physical sensation, with your breath, with fantasy rooted in real experiences or emotional connection, and with being fully present in your body. This process retrains your brain and body to derive pleasure and arousal from more natural, sustainable sources. It helps rebuild the neural pathways responsive to touch, intimacy, and the slower, richer buildup of real-world sexual experiences. This shift requires patience and commitment. It won't happen overnight. However, the potential reward is immense. The restoration of a deeply fulfilling, connected sexual life that no screen, no matter how high definition, can ever authentically replicate. It's about reclaiming your capacity for authentic human intimacy. While neurological conditioning can profoundly alter how your body responds to sexual stimuli, the final and perhaps most subtle mistake we must address pertains not to your actions or your consumption, but to your fundamental attitude towards the act of masturbation itself. It's a mistake rooted in perception, and its consequences are pervasive. Mistake 5. Failing to treat masturbation as a conscious health practice, the perils of mindless habit. Among all the errors I encounter, this fifth one might be the most insidious, because on the surface, it doesn't appear overtly harmful. There's no excessive force, no lack of lubrication, no ignoring pain. However, for men navigating life beyond 60, the way you conceptualize and approach masturbation transcends mere pleasure-seeking. It becomes intrinsically linked to your overall sexual health and well-being. When you treat it as a purely automatic, mechanical act, a quick stress reliever before sleep, a habitual release driven by boredom or routine, a purely physical act devoid of mental or emotional engagement, you risk undermining your sexual health in profound and often overlooked ways. This casual, disconnected approach does more than just potentially reduce physical sensitivity over time. It actively erodes your fundamental relationship with your own body. Engaging in masturbation mindlessly, rushing through it solely to reach orgasm, or performing it while distracted, watching TV, scrolling through non-sexual content, severs the vital mind-body connection. You stop being an active participant and become a passive bystander to a physiological process. In this state of disconnection, you become deaf to your body's subtle communications. You fail to notice the early whispers of strain, perhaps a slight decrease in ease of erection, a minor twinge that wasn't there before, a subtle reduction in the intensity of sensation, or a feeling of fatigue afterwards. You become oblivious to changes in your response patterns, your level of desire, or the quality of your orgasm. This lack of awareness prevents you from making timely adjustments to your technique or frequency. Furthermore, this disengagement disrupts the natural, healthy rhythm of sexual response. Healthy sexual function, especially as we age, thrives on a balance of arousal and relaxation, engagement and release. Mindless masturbation often bypasses the natural buildup of arousal, the plateau phase, rushing straight to orgasm without allowing the vascular and nervous systems to fully engage in a balanced way. This can contribute to erectile fatigue, where the system becomes less responsive over time due to incomplete or rushed engorgement.
The danger inherent in treating masturbation casually extends far beyond the purely physical realm. It has significant emotional and psychological dimensions. This disconnection can foster feelings of numbness, emptiness, or dissatisfaction even after orgasm. It can paradoxically lead to a need for more frequent sessions or increasingly intense stimulation, harsher grip, more extreme fantasy, just to achieve the same level of sensation or release, creating a cycle of diminishing returns. Over the long term, it can contribute to a general sense of sexual apathy or even performance anxiety when with a partner, as the effortless arousal experienced alone, often aided by fantasy or porn, doesn't translate to the more complex reality of partnered sex. When you consciously reframe masturbation as a mindful component of your overall health regimen, akin to stretching, meditation, or a healthy meal, you reclaim agency and deepen your somatic awareness. Approach it with intention. Create a conducive environment. Slow down significantly. Focus on your breath, synchronizing it with your movements. Cultivate deep awareness of the sensations arising throughout your body, not just the genitals. Explore different types of touch,
Light, firm, slow circles focusing on different areas. Allow arousal to build gradually. This transforms the act from a mechanical release into an experience of self-connection, relaxation, exploration, and even somatic healing. When masturbation becomes a mindful practice, you naturally become more attuned to your body's signals. You develop a keen sense of what feels nourishing and what feels taxing. You're more likely to notice subtle changes in function or sensation, allowing for early intervention. You inherently reduce the risk of physical harm by being present and responsive. Perhaps most importantly, you enhance the quality of the pleasure you experience, fostering a deeper appreciation for your body's capacities. This mindful approach cultivates a sustainable, respectful, and ultimately more fulfilling relationship with your own sexuality, laying the foundation for continued vitality and presence, whether you are alone or sharing intimacy with another. So if masturbation has become little more than an ingrained habit performed on autopilot, it's time for a profound reconsideration. How you relate to your body and its expressions of pleasure now will profoundly influence how well it serves you and how much joy it brings you in all the years to come. This mindful foundation is crucial for integrating the avoidance of the previous four mistakes effectively. Conclusion. Sexual health after 60, a foundation for dignity, connection, and joy. If you've journeyed with me this far, absorbing these critical insights, I want to speak to you not just as a doctor, but as someone who has dedicated his professional life to understanding and restoring men's sexual well-being. My purpose in sharing these often uncomfortable truths is not to instill fear or shame, but unequivocally to empower you, to give you back a sense of control over a vital aspect of your life that profoundly impacts your identity, your relationships, and your overall happiness. Over 3 decades, I've sat across from thousands of men, husbands who cherished their partners, veterans who carried unseen burdens, grandfathers who found joy in their families, hardworking men who built lives and provided, men who arrived at my door not merely because of physical dysfunction, but because they felt a piece of themselves was missing, fractured, or diminished. A common thread in their stories was a deep-seated frustration. No one had ever explained the profound shifts that occur with age. No one had warned them that clinging to the sexual habits of their youth could silently sabotage their vitality. They were navigating uncharted territory without a map. We've meticulously explored 5 critical masturbation mistakes prevalent among men over 60. 5 ingrained habits that, while perhaps feeling harmless or familiar on the surface, possess the insidious power to gradually, silently, yet relentlessly erode the foundations of sexual confidence, function, and profound connection. 1. The death grip. Applying excessive force, damaging delicate nerves, restricting vital blood flow, and potentially causing internal scarring. 2. Masturbating without lubrication, subjecting fragile, aging skin to destructive friction, leading to micro tears, chronic inflammation, loss of elasticity, and potential fibrosis. 3. Ignoring prostate feedback, overlooking signals of discomfort or congestion, risking chronic prostatitis, urinary issues, and impaired erectile function. 4. Habitual consumption of high-stimulation pornography, rewiring the brain's arousal and reward pathways, diminishing responsiveness to real intimacy and connection. 5. Failing to treat masturbation as a conscious health practice, engaging mindlessly, severing the mind-body connection, missing early warning signs, and undermining sustainable pleasure and function.
These are not abstract medical concepts. Behind each point lies the very real pain, confusion, and regret I've witnessed in the eyes of men who only understood the cause of their suffering when it was deeply entrenched. Their stories motivate me daily. Yet, intertwined with this pain is powerful, tangible hope. I have also been privileged to witness remarkable transformations. Men in their 60s, 70s, and even 80s who, upon understanding these mistakes and implementing changes, experienced a profound renaissance. They softened their grip, embraced lubrication, learned to listen attentively to their bodies, especially their prostate, consciously reduced their reliance on high-stimulation porn, and began approaching self-pleasure with mindful intention and respect. The results extended far beyond improved erections or restored sensation. I saw confidence blossom anew, replacing anxiety and shame. I witnessed intimacy with partners rekindled, deepening bonds that had grown distant. I observed a renewed sense of vitality, dignity, and peace of mind, a reconnection with a fundamental aspect of their being. Therefore, if you see reflections of your own habits in any of these 5 mistakes, please take a deep, steadying breath. Understand this: you are not broken. You are not irrevocably damaged. You are not past it. You simply haven't had access to this crucial physiology-specific information until this moment. That changes now. Starting today, right now, you possess the knowledge to make different choices. You can choose mindfulness over autopilot. You can choose gentleness over force. You can choose lubrication over friction. You can choose listening over ignoring. You can choose presence over distraction. You can choose to view your sexual health as an integral, respected component of your overall well-being. By making these conscious shifts, you are doing far more than merely protecting your penis from avoidable harm. You are actively safeguarding your future capacity for joy, for deep connection with yourself and others, and for the inherent dignity that comes with feeling whole and in control of your own body. Your sexuality does not come with an expiration date at 60. It does, however, demand evolution. It requires adaptation, a willingness to learn new ways of being intimate with yourself, and the courage to take conscious ownership of your health. The men who embrace this evolution, who proactively adapt their self-care practices to honor their changing bodies, are the men who continue to discover richness, pleasure, and profound connection in this vibrant chapter of life. So pause and ask yourself with honesty and hope, what kind of man do you choose to be in this next significant phase of your journey? The answer lies within your power. You still possess ample time. You still hold immense agency. And now, critically, you have the essential knowledge to reclaim your sexual well-being and step into a future defined not by limitation, but by possibility, presence, and enduring vitality. The power to shape that future rests firmly in your hands.